where hospital administrator Lillian Posadas is sitting by for our Monday morning update. Good morning, Lillian.
Good morning. Good morning, Chris. Good morning, Bree. Good morning, Jason. And good morning, Guam.
Good morning, Guam. Lillian, are you a singer?
Monday. God did not bless me with that talent, but I admire and I really appreciate those with musical talent. I love listening to music.
We do too.
Yeah, we do. Lillian,
I bet you she's got a lovely singing voice.
I know, she's just being humble.
Can't even sing in the shower.
That's actually the best place to sing because of the acoustics. That's why people sound good in the shower.
My voice doesn't sound good in the shower, so I don't bother.
Maybe you got to turn the water up harder.
I guess.
8:05. Lillian, good sharing a laugh with you. As you know, most of our conversations have been really,
Gotta have humor.
right, really serious. So, just trying to make sense of these hospitalization numbers. As it seems like the totals are dropping, but I've seen just a slight increase in the number in ICU. But that was last week, so we don't know what transpired over the weekend. So, what's the very latest, Lillian?
Yes, we are at 28 in the house. We do continue to see individuals come through the emergency room. We have 9 of the 28 at the ICU level of care. And of the 9, 7 of them are on ventilator support. At the CIV, we have 3. And hopefully, I'm meeting with the executives this morning that if we can stand down the CIV so we can get the contractor to work on the HVAC, that will be great. If we can get that done this week.
Yeah, it actually sounds like a good time. I mean,
Yes, it is. It is a good time. No patients in there for potential transmission of any infection. So it really is going to be the perfect time.
Mm-hmm. And if we can just go over for our viewers and listeners who aren't aware, the reason why you're trying to get the HVAC fixed to use the SIP.
Right. Because it's one whole unit for the ventilation, the air conditioning, one whole unit for the entire facility. And so, with COVID being airborne, transmission from one patient to another or one area to another, especially those who are non-COVID, we don't want to take that chance. Mm-hmm. So we need to split the HVAC between the wings, A wing, B wing, and C wing. C wing is right now the wing that we have the the COVID patients convalescing, ready to transition home or to the ISOFAC.
Mm-hmm. And so when the HVAC is fixed, therefore you would be able to bring back the initial patients, right, that were at the SNU that are currently over at Catholic Social Services?
Correct. That's one plan, and the other plan is to use the other wing for non-COVID subacute patients, also med-surg. Mm-hmm. So we can maximize the utilization of that facility.
Mm-hmm. Any updates on BAMLAM and convalescent plasma?
We gave some distribution over the weekend, and convalescent, I haven't gotten an update, but there were some orders that the doctors have prescribed for some patients to receive. Total number, I'm waiting for the response from our team.
Mm-hmm. Well, okay. You don't have the total number for BAMLAN VMAP?
Well, I'm looking at either 7 or 8 total is what my last count, but there may be more. So, so far it's working out very well. The antibody, monoclonal antibody transfusion, we haven't received any reports of any adverse or complications from it. So, it's boosting the immune system with more antibodies.
Any new staff?
Through the week, last week we received, but I haven't gotten an update for the weekend if we received any. But we do have quite a bit of staff on board, from the 2 staffing solutions company. And we're also we have some local individuals who completed the theory part of the fast track certified nurse assistant program. Now they're on boots on the ground, working on their psychomotor skills and, getting clinical training. Mm-hmm. So, that's going on right now. And there's going to be a new group I believe, if not the end of this month, that they're going to start a new group of 30 individuals.
So is
So
that
we're growing our own.
is that the size of the first group? It's about 30 people, Lillian.
It started out with 30, but I understand that 2 have dropped out for personal reasons. And so it's at 28 right now.
And what are you able to talk to these people who are going through this fast track process?
Am I able to talk to
Yeah,
them?
what are they
them?
saying? Like, what was the motivation for them to kind of jump into this program?
Well, I guess they realized, like, one of them was in the news, that they want to participate in this response for caring for people with COVID. They want to make a difference in people's lives, and so, and some of them have lost their jobs, so it's a new opportunity for them. And really, if they get on this track of healthcare, they can go on to become licensed practical nurses or registered nurses, or in another area, another discipline in the healthcare field. So, there's many opportunities for them.
Anything new with the vaccine?
I haven't heard anything new other than it looks like the FDA and the CDC are soon to give the approval, the EUA approval. And so as soon as they get it, the distribution throughout the US and also to the territories will happen. And so we're preparing our freezer storage for it. So, we're working on getting ready. And I'm waiting for, I'm actually going to have a meeting with public health to discuss further the details, because like, how are we going to administer this medication, this vaccine? How many millimeters of solution is it intramuscular, or, those are the details that we're waiting to receive instructions on. We'll follow up today.
Right. Anything else going on? I know that the work that the Army Corps of Engineers and their contractors, have they completed their work, or they're still working on those infrastructure improvements?
The Army Corps, the project is to augment the COVID Care Unit 2, where we have that as a ICU level of care, and we switch it back and forth to either COVID or non-COVID, depending on the demand with patients who need it. So that's the area. That's a project that we're waiting for the Army Corps to come back to us and let us know when they're going to begin. They've done the assessment, and so we're going to try and see when that project is going to get started and be completed.
Any more staff exposed to the virus, Lillian, since the last time we spoke?
Not since last week, knock on wood. We don't want to jinx it. We are at 93 employees who tested positive, but majority of them, I think only one was still in isolation and 1 or 2 were in quarantine. And that was last week. So I'm looking forward to, finding the result, seeing the result that they're all back, cleared to return to work, and no other staff tested positive.
And this week is actually pretty critical because the waiting period to see whether or not we're going to see any sort of a surge, right? Yeah. Right. So hopefully,
Yeah. What's your feeling on that, Lillian? Because we will be hitting the 2-week mark this week, and that was kind of like the litmus test for whether or not people were taking the CAR score and just the governor's message and other messages about.
Looks like it. Yeah, it looks like it because it's already how many days post Thanksgiving, and the numbers continue to be low. So it looks very hopeful and very promising that people really are taking this precautionary measures seriously, and so it looks like it. And so because I probably already we would have had a surge of numbers, but I don't want to jinx ourselves. If we can continue this trend, downward trend, it's a good sign. So, very hopeful.
And then, just I guess generally speaking, right, the people who are hospitalized, the ones in the ICU receiving the ICU level of care, is the COVID, because there was a while where it seemed like there was a really, and I don't even know if this is scientific or whatever, but it seemed like the COVID that they were getting was just really bad, and we're just losing so many people. So how sick are the people in the hospital now? And is there any cause for hope that they could recover?
They're stable, and you know what the clinicians are telling me, Dr. Alvin, that when these individuals are starting to have symptoms, they don't realize it that their oxygen level is low. They don't really feel it, so it's kind of like a silent hypoxic level. And so when they come in with an oxygen level really below 50%, then it puts them in a very tough situation to recover. But as soon as they come in, starting to feel the symptoms, they need to get their oxygen level checked, and then they can get the treatment right away. But if they wait till it goes below 50, that's when it gets really, really challenging for them.
Anything in closing, Lillian, that you want to say?
Oh, again, everybody just continue to wear the mask, continue to take the precautions, because it's all of us that can make this, that can help us get through this. It's all of us.
Thanks, Lillian. Stay safe.
Thank you too.
Be
Have a
safe.
great day.
Jason, what do we have virtually in the Zoom room?
Well, we were talking about it earlier, but Auntie Lillian, we got a virtual star apple.
Wow.
Wow.
Yeah.
All right. I'll get that. Fresh fruits.
Yeah,
Everybody
exactly.
take your
No,
vitamins.
I got it from my grandparents' house in Agani Heights, so that's where the best star apple grows.
All right. There you go. A good source of vitamins.
There you go.
All right.
Bye-bye.
Thank you, Lillian.
Bye.
Okay. Hey.